Hello. It's okay. I want us to discuss something very important, something almost so many persons have been asking me to talk about in kidney health class. So I dedicated today to that conversation. Okay. Yes. I dedicated today so we'll have I dedicated today so we'll have that conversation. So, what is this conversation all about? So, the conversation is all about our kidneys as usual, but this time around we won't be talking about kidney stones because we've discussed a lot about kidney stones. So today we'll be discussing something that is quite different from kidney stones, but something that actually does what affects our kidneys. So, and what is this that actually affects our kidneys that I want us to talk about? I want us to talk about kidney infection. Okay, so a lot of us have certain health conditions or health issues like frequency urination, um, lower back pain, and not the rest of them. Some of us we did scan, and what our scan is showing is that we have what is called pyelonephritis, or what the doctor may choose to, what the layman may actually choose to call kidney infection. So, so in this very class, we'll be sticking to the name kidney infection so that we'll be able to carry along those who are medicals in our midst and those who are not also into medicals. So we have something we call kidney infection. And also, for me to go into that, I also want to lay a foundation. I know that most of us who have been in this um, channel for some time now, you would have heard me describe what the kidney is over and over again. But for the sake of those that will be watching this video for the first time, or those that will be joining us later who do not know much about the kidneys, I'll be making this summary of what the kidney is and what the kidney does. Okay, the kidney is actually a bean-shaped organ located behind the peritoneum that actually has the function of removing waste, um, regulating fluid level in the body, maintaining homeostasis, controlling blood pressure, and also controlling blood level. So the kidney has a lot of vast function. So in this just is to summarize what the kidney does for us. Okay, so the kidney is actually very very essential for life. That is why the kidney actually starts functioning intrauterine. Okay, the kidney starts functioning right in the womb. Okay, that is when the kidney function, and the kidney is expected to carry us all through life. So now, what is kidney infection? Kidney infection comes in when the kidney becomes invaded by microorganisms. Okay, what do I mean? I said when the kidney becomes invaded by microorganisms. Okay, we have microorganisms like bacteria, we have virus. So when any of these microorganisms invades the kidney, that is what we call kidney infection. When it invades the kidney, that the body, that the what do we call that again? That the immunity can no longer be able to fight when the microorganisms have actually overwhelms the kidney. That is when overwhelms the immunity. That is when we can say that this person has actually come down with kidney infection. So now, when this person comes down with kidney infection, how will the person know that yes, I'm actually having kidney infection? Okay, how will somebody know that he or she is having kidney infection? Okay, one of the things that this person is going to notice, like one of the primary things, most of the people watching this video right now, or maybe those who will be watching later, or let's say most of the people who have interest, who have keen interest because of one health condition they are having or the other, that are watching this video or want to know if what they are actually having is kidney related, watching this video, one of the things that would have brought them to this place or brought them to me, to my WhatsApp group, because I have a WhatsApp group where I teach people how you can actually maintain your health. I know that most of us watching this video actually came from that group. So now, one of the things you're going to notice is lower back pain. So this lower back pain is actually very, very common for people who have um, kidney infection. So not just kidney infection, but both those who have kidney stones. So these are the things that are actually very, very common with them. Okay, so lower back pain. So some people say it's a kind of not just lower back pain, they also feel pain by the side or at the groin. Okay, so when someone is having kidney infection, this person will experience the exact things. Okay, that is why I tell people it is not actually very, very okay for you to just conclude that you're having certain ailments because of the signs and symptoms you're feeling, because a lot of sickness can actually have similar signs and symptoms. So you actually need someone who is actually knowledgeable to guide you on how you can actually handle a certain condition. So if you're having kidney disease, if you're having kidney stones and you're treating kidney infection, you can see that you're not going to get the desired result. Okay, if you're having kidney infection and you're treating kidney stones, you may not have the desired result. So this is why you need someone who is actually knowledgeable to guide you through. That is why I actually ask people, I actually encourage people to actually buy into my coaching class, because I have this WhatsApp group. It's actually a general platform that I actually talk to people about their health in general. But if you need someone who can actually coach you one-on-one, you can actually subscribe to my coaching section, which is very, very simple, by getting any of my ebooks that cost 5,000. You've automatically subscribed into my coaching section and we'll begin our coaching journey. So the aim of this journey is to actually make you to recover as fast as possible, because when you don't recover as fast as possible, you're spending time, you're spending money, and you may run into complications that you may never come out from. But that is not going to be our portion. So now, after aside this lower back pain, side pain, and pain at the groin, you may also notice that you're having fever, you're having chills, you're having not feeling of vomiting and actually vomiting. You are having this. You look at urine. Your urine will begin to have this kind of offensive smell. Your urine will start becoming cloudy, and sometimes when you go to urinate, you discover that it's actually painful. And some people would start visiting the toilet, the restroom, over and over again because of they have infection. So they have kidney infection. So these are the things that you actually see in a person, and you'll be able to say that look at what this person is actually passing through, or what this person is actually having. So I've talked about painful urination, I've talked about continuous urination, I've talked about the urine may become dark in color, may become cloudy. Cloudy in the sense that you will see some, it will be as if they poured smoke inside the urine. Okay, this urine will appear cloudy. I wish I have a sample of those urine here. I would have actually showed it to us. So that is that about the things that you can actually see. So seeing signs and symptoms is not enough. I've said this before and I'm repeating it again. Noticing and having knowledge of signs and symptoms is not enough. So I told you that this is one of the reasons why you need someone who is knowledgeable to guide you, your doctor, your nurse, your pharmacist, who is knowledgeable in this aspect of health to actually handle your case. Okay, so someone actually joined our group yesterday. Okay, let me not talk about that. So let's go over and talk about more serious things, more of the reasons. No long story, because I want this discussion to be as short as possible. So now, when you've actually mastered the signs and symptoms and all the rest of them, what actually is important again for you to understand is the tests to confirm that really this is what you're having. You don't just conclude by signs and symptoms that this is what you're having. That is what most people that come into my group, that's what they do. They just come into the group and tell you that what they want is just drugs, and what they want is just supplements. That everything I'm saying that they are feeling it already. That it means that this is what is wrong with them. Meanwhile, see that is a problem. You complain about that this is what I said is everything that you're actually feeling. So and you now you now go back to start treatment of what you don't know. At the end of the day, you now have to go back to do tests again, something you would have done in the beginning, and by so doing, you are spending more money and you may run into the risk of developing complications. Okay, money you that saved and used for another thing, using it for to repeat a process. And sometimes I've seen a guy who have done all through so many things, and by the time he came and I asked him to go for test, he was resistant to all the drugs that was written out for him in that particular test. Okay, so now one of the key investigations that you need to do if you have all these symptoms I've actually mentioned is to go for urine culture test. Urine culture test is done with your early morning urine, and the urine will need to be cultured between 24 to 72 hours, depending on the culture medium the lab scientist would want to use. Okay, between 24 to 72 hours max. So that is when the result will be out, and it is being done. It's better done with your early morning urine. So I don't know if I'm communicating your early morning urine. So and it takes that long time. So this urine culture is going to reveal the type of microorganisms that has invaded your kidney. It could be bacteria, it could be virus. So it is this urine culture test that will actually tell us that this is what it is. It is the urine culture test that will tell us that this is what it is. So it is from that urine culture test that will also write out some of the medications, the antibiotics that will actually help you to recover. So now you start using these antibiotics and use these antibiotics for a period of time. So after using the antibiotics for a period of time, it is actually expected of you that you do what? You go back to run investigation, repeat that urine culture test. When you repeat that urine culture test, to know how far the treatment you actually you've undergone, how far it has handled this particular bacteria or whatsoever invading microorganisms. By the time you've known how far, it is not, you now take it to your doctor or whosoever that is handling your case. He will now look at it and look at how far we've gone. Then see the antibiotics that they can still use. You still go back to it and repeat this same treatment. But the problem that we have in Africa, but the problem that we have most of the times is that after treating, going for urine culture test, the result comes out and it's showing that we have this particular kind of infection, and we start treatment. At the end of that treatment, we expect everything to vanish. This what do we call it? Kidney infection is not malaria. Kidney function test is not it's not malaria. Let me just use it like that. But malaria can also be very serious. But let me just say it's not malaria. This is because you need to treat this condition until you don't give it chance. Okay, you need to handle it squarely until you are free. Okay, so now you also need to do for you to know that it's actually kidney infection, because urine culture test will show if there is any invading microorganism along the urinary tract and in the kidney. So to confirm that the source of this infection is actually from the kidney, a scan can actually can actually detect some abnormalities that will actually reveal that what this person is having is pyelonephritis, or what is called kidney stone. Then you know that this is what it is, and you start treatment. I have my cyst-stone here that is actually used as a cover for this treatment of kidney infection. Okay, most of you have used a lot of antibiotics and you're looking for alternative stuff that you can actually use to handle kidney infection. With cyst-stone and following the treatment that is actually required, you will actually be free from kidney infection. So having said that, now how do people get kidney infection? How can someone's kidney get infected? So one of the ways you can actually get kidney infection is from bladder infection. When your bladder, because bladder is one of the urinary pathway. When the bladder is infected, these microorganisms can actually travel upwards and cause kidney infection. So it can also be bloodborne. Like it's occurring through the blood. It can also be due to contact, maybe from the bowel and not the rest of the intestine or the rest of them communicating with the kidney in the abdominal cavity. can actually lead to certain conditions. That is why when you go to lab tests and you tell that you're having E. coli, this is because E. coli is one of the organisms that can actually cause that is in the ball. So it's in the bowel, like yes. So when not properly handled, when okay, it's in the GIT, and in that place, it's actually a normal flora. It doesn't cause any problem. But by the time it travels to enter the kidney or the urinary tract, it becomes an issue. So it could also be staph. So a lot of all these other things can actually be in position to cause kidney infection. So having talked about that, and we've talked about the signs and symptoms, we've talked about it can develop from the bladder. So another thing I want to say is that this kidney infection we're talking about is more common in females than in male. Okay, what did I say? It is more common in females than in male. So if you're a female, you need to watch out for this condition, and you need to protect yourself. So one of the ways to protect yourself is to drink a lot of water. And during sexual intercourse, it is also very important that you urinate immediately after sex. It's going to help you to actually prevent infection in a way. So having said that, which is, by the way, we're not in a sex class, but some people believe that it is also not very good, especially if you're an expectant mother. For you, it's not very good that you rush out of bed immediately after sex. So now, if you don't treat kidney infection, it can actually become something very, very serious. Okay, like repeated attack of kidney infection can actually cause kidney stones. We know about the struvite stones. So now, that aside, when you don't treat infection, you can develop what we call sepsis, general body infection, because all the blood that moves around your body actually gets to the kidney. So by the time they get to the kidney, they can carry some of these microorganisms and spread them. And if your immune is overpowered, it can lead to very serious condition that you start having sepsis. And if the liver is affected, you start having jaundice and all the rest of them. And if the heart is affected, you know how dangerous that can be. So it's actually a very dangerous condition that needs to be tackled head on. So it could actually cause permanent kidney damage. I've said a lot about kidney failure, so that name comes with a lot of things. So I prefer to call it permanent kidney damage, so that you know that this kind of damage cannot be reversed. Are you hearing me? So that you know that this is called permanent damage to the kidney. This is what untreated or poorly managed kidney infection can actually cause. The truth is that we are not going to let it get to this condition, because we are going to we have already started learning things that can actually help us to overturn this condition. And if you are treating kidney infection, there's this thing that you need to do that is very, very important. Taking citrus is also very, very important. All these oranges and the orange family, it is very important that you take them during your course of treatment, because it will help you to alkalinize, it will help in the flushing of the bacteria or the microorganisms along that way, and it will create this acidic environment that will make the whole place to do what to be fit for cleansing and purging of the urinary tract, because most of those microorganisms may not be able to function in acidic medium. Then during this treatment, it's also very important that you look at your general body homeostasis. One of the ways this homeostasis is maintained is by the kidney. When the kidney is having issues, where is battling with this infection, this homeostatic effect may not be really maintained. That is why if you're treating this condition, and most of the food we eat is acidic, and you're taking the juice you're taking that will help the cleansing, it is also good enough that it takes something that is going to help to work on the homeostasis of the body. And one of the things that you can use is Rival alkaline water. So if you're here and you've not used this, you're treating kidney infection, this is actually very important that you get Rival and do what and use. So these are the best way. It's also very important that you get Cystone. So Rival and Cystone works hand in hand. Okay, Rival and System works hand in hand to make sure that this infection that you're having, that you actually kick it away from your system. So we also have antibiotics that actually work generally. So I may not really be posting them here, but if you want us to talk about your this kidney infection squarely, or you really want me to be your guide through your treatment, you can actually reach out to me on WhatsApp or on the comment section here, and I'll drop my WhatsApp details for you so we can actually talk in depthly. So remember, for you to subscribe to my coaching platform, is going to my coaching section, or we call it consultation section, is going to actually cost you something. Okay, you actually pay 5,000 naira for consultation, and that 5,000 naira consists. You also get my ebooks for free. Kidney health guide, which is 2,500 naira, and crushing kidney stone ebook, which is also 5,000 naira. You are getting both of them, and you're getting the kidney cleansing recipe, where we have fruits that you can actually take that will help cleanse the kidneys. Okay, so when you're actually treating kidneys infection, it's actually very important that before you start any treatment you're taking, you take that smoothie recipe to help flush your system. And by the time you're done with the treatment, it's also very important that you repeat this smoothie recipe, that it will help cleanse you. This smoothie recipe, you're getting it from me for free if you subscribe to my consultation section, if you pay for the ebook. All of them are the same thing. The ebook, the consultation sections, the ebooks, sorry, because you're getting two ebooks. Kidney health guide that will teach you how to safeguard your kidney. Crushing kidney stone that will help you fight kidney stone if you have kidney stones. You're also getting the smoothie recipe, and you're getting the coaching section from me. And my coaching section, normally, if not what I have done to reduce this, to make it accessible for everybody, I usually charge 10,000 naira for that consultation fee. So now it has been crashed. So you're getting the consultation, you're getting the ebooks, the two ebooks, you're getting the smoothie recipe, all this packaged in this 5,000. Is it not mind blowing? So I would like to work with you, and I would like to actually also take questions and answers from you. So if you've actually enjoyed this presentation this morning, I want you to please don't be stingy with your sharing. Share this message to everybody in your contact. You don't know who this message is actually going to help, going to benefit. If you have a family member that has been